Within the last few hours, Governor Brian Kemp announced 2 new groups of people who are eligible for COVID-19 vaccines starting on Monday. Pretty significant groups here. It includes people 55 and older and Georgians with serious medical conditions like moderate to severe asthma, cancer, diabetes, heart conditions, obesity, and sickle cell disease. The expansion is important, with the CDC ranking Georgia as the worst out of all states when it comes to getting people their first dose. You can see here we're the only state right now considered like in that category. It's blue there on our map. Brittany Klein-Peter is live at the state capitol after speaking to the governor. What do you have to say about this, Brittany?
Despite criticism that Georgia continues to lag behind other states, Governor Kemp once again defended the state's vaccine rollout plan, saying they're getting vaccines into arms as quickly as they can.
This data is very clear. Every metric on the COVID-19 pandemic is headed in the right direction.
While Governor Brian Kemp says the state is making strides in its fight against COVID-19, the CDC says Georgia still has one of the lowest vaccination rates in the country. According to the latest data from the CDC, which was just updated yesterday, the majority of U.S. states have administered 86% or more of their first doses they've received. But Georgia is faring the worst, falling between 60 to 69%.
So I think that a big challenge that Georgia is facing is making sure that they're matching up dose supply to where it's needed.
Public health expert Amber Schmidt blames poor matching for the state's lag in vaccination efforts, adding that the state should more closely monitor appointment availability.
There's virtually no vaccine appointments available in the Atlanta metro, but there's lots outside of the Atlanta metro. And so what that shows us is that there's more demand inside the Atlanta metro and maybe not so much elsewhere. And so maybe the doses need to be moved around to where they can do the most good.
Governor Kemp says that the state is working to move vaccines where the demand is greater by using data from its GEMA mass vaccine sites, as well as working to promote the Johnson & Johnson vaccine. The governor said he would be getting that vaccine himself to show its effectiveness. Coming up at 6, I'll dig into what public health experts say could help Georgia catch up with the rest of the country.